26 countries, 90 programs, 11,000 victims of sexual violence, 90% of them female, most under the age of 18. These statistics from 2015 illustrate the scale of the problem MSF teams have to contend with, but they reveal none of the trauma and the thousands of lives shattered by sexual violence. What can MSF teams do to help these people and, when necessary, protect them? The clinic in Mathare in Kenya is open 24/7. Located in the heart of Nairobi's slum district, it's MSF's largest program for victims of sexual violence. The staff's priority is to provide a caring, safe and confidential environment for people who have been subjected to this kind of trauma, however long ago it may have happened. However, victims need to get medical care within 72 hours to effectively combat the risk, for example, of HIV infection. So MSF teams have reached out to communities living near the clinic to combat the stigma associated with sexual violence and to let them know care is available. They also work closely with other actors, starting with the police, to ensure that victims of sexual violence are referred to the clinic as quickly as possible. A helpline and an ambulance service facilitate access to the clinic for people without any means of transport, especially at night. During their first visit, victims are given psychological support and medical care if they have any physical injuries. Not all patients find it easy to talk about what has happened, but it can be easier to confide in a member of staff trained in how to listen, advise and reassure them. Patients are also tested for HIV and are given preventive treatment to reduce the risk of infection if they've been exposed to the AIDS virus. They receive treatment for sexually transmitted infections, are vaccinated against hepatitis B and tetanus, and women can obtain emergency contraception. Soon after, they can do a pregnancy test and choose to have a safe abortion or to be referred to a clinic for antenatal care. The teams also seek to protect victims. Many of them know their aggressor or even live under the same roof, in which case MSF can assist them with short-term accommodation. They also help patients to defend themselves against their aggressors. Medical certificates are delivered during consultations for victims to use if they wish to file a complaint. And MSF staff can give evidence in court when called on to do so. Opened in 2008, the clinic in Mathare has extended its activities, namely reaching out to the communities to raise awareness and facilitating access. This has led to an increase in new patients, from 150 in 2011 to 2,400 in 2015. This effort to facilitate access to care for victims of sexual violence is ongoing. A programme of decentralised care necessitating training Ministry of Health nursing staff has also been set up to ensure that all victims can get appropriate treatment easily.